All right, well, I guess I'll go ahead and get started. Thank you guys for coming. My name is Sara Lemin. I am an OBGYN. I live south of Cleveland, and I'm also an AMC mom. So 20 months ago, our son, Kalen, was born. He has amyoplasia, and we also have 4 teenagers. So he was a bit of a surprise blessing for us. But when we found out that we were pregnant, everything seemed to be going normally. And other than the fact that I was 40, everything seemed fine. And I would, as an OBGYN, I have access to ultrasound machines in my office. So I would sneak over at lunchtime and peek at him, and he would wave at me, and I'd go back to work. But then at my official 20-week ultrasound, he was diagnosed with bilateral clubfoot. And my OBGYN training kind of sparked somewhere in the back of my brain, and I thought, okay, clubfoot, they get casts after they're born, no big deal. That's the worst that we are dealing with. We can handle that. And still at that point, didn't pick up on the fact that he really wasn't moving the way that I thought he was. I felt him, and I thought he was moving normally, but then we went and had a specialist scan at maternal fetal medicine, and they were the ones that really said, he really doesn't move the way you think he should. He moves, but his arms are always in the same position, and his legs are like a pretzel, and they kick, but they kick as one whole unit. And I had never picked up on that before. So as an OBGYN, that was pretty embarrassing that I didn't even recognize that myself. So then I started to get more involved with arthrogryposis and learn more about it. And I had the opportunity to go last year to the symposium in Philadelphia. And one of the sessions during that, one of the breakout sessions, talked about prenatal diagnosis. And basically we sat around the room and talked about how bad we are at diagnosing arthrogryposis during pregnancy. We talked about the fact that there really aren't a lot of specific guidelines for ultrasound. There's not a consensus among providers as far as what to do during their prenatal care, and even how to counsel them at the time of their delivery. So I came away from that meeting with a couple of topics that I wanted to pursue. One of them was to look at what are the current guidelines. Are there any? Is there anywhere that I, as an OBGYN, can go to figure out what I'm supposed to do if I have a patient that I think has arthrogryposis? And then I wanted to get an idea too of what other families had experienced during their pregnancies, and if this was just something that I happened to miss because I'm in a small town in Ohio, but everybody else catches, then maybe it's not as big an issue as we think, or are we really doing as poor a job as we think we are? And then wanted to come up with a way to raise awareness among OBGYNs and midwives and radiologists so that we can improve how we detect arthrogryposis during pregnancy. So I went to the 2 resources that are my go-to for my profession, the American College of OBGYN and the American Institute of Ultrasound in Medicine. And they have almost identical checklists of this is what you're supposed to look for when you do a routine anatomy scan at 20 weeks. And if you look at this checklist, there are 6 different structures that you're supposed to look at just in the brain alone, and there are 5 different structures that you're supposed to look at in the heart. But when it comes to extremities, it just says, are the arms and legs present? Are the hands and feet present? It makes no mention of looking at the shape of the limbs or whether or not they're moving at all or moving appropriately. So this is definitely, I think, an opportunity where we can improve if we can change what our guidelines are or what our checklist includes. So then the next thing I wanted to do was get an idea of what experiences other AMC families had had. And the best way to do that is with social media, right? So I created a little SurveyMonkey survey and put it out there on Facebook. There's a couple different support groups, as many of you guys know, on Facebook. And so I just kind of posted it there and said, hey guys, take my survey. And within the first week, we had almost 300 responses. So, it's important to note that this was completely informal. This was not institutionally sponsored. It's not anything that I can report data about in any way. That didn't have consent from anybody other than that they took it. But it was just a starting point to get an idea of what do we need to ask in a more formal survey And what are some of the things that our families experienced. So looking at I don't have time to go through all of the responses, but some of the more interesting ones I'll show you. We had, like I said, over 300 responses from pretty much everywhere. Right? That's the power of social media, is that we have every continent that's inhabited represented, almost all the states, many of the Canadian provinces. So I feel like we got a pretty good overview of world experiences. And most of the results were what you would expect. If you look at the type of AMC, the most common, or about a third, in this case it was a little over 40%, had amyoplasia. Some of them didn't know, or they're in the process of being diagnosed. The most common age range of the children of the parents who responded was between 0 and 5 years old. So there's a lot still to be learned, I think, for many of those families. But a lot of the other demographics were the same as you would expect for any population of pregnant women. So it wasn't like they were all 40 years old, or that they all had major complications during their pregnancies. Most were young, healthy women that otherwise didn't have any risk factors. And to me, this is the most sad, or the most important slide of all, is that I asked when were you diagnosed? And almost 60% of these families didn't have a diagnosis before delivery. So there is definitely room for improvement here. Of those that were diagnosed during their pregnancy based on ultrasound, the most common findings, and many of them had more than one of these, are what you would expect. I don't know if you can see it up there or not, but clubfoot was the most common, and then many of the other joint contractures were the most common findings. But then there were a lot that I wasn't expecting, or at least didn't realize should be included on this list. Most commonly gastroschisis. That tended to be more common than I was expecting it to be. And then at the bottom, the green line that says other, the majority of those were people who responded, I wasn't diagnosed during pregnancy. So we've sort of since corrected that in the format of the survey. So the other thing I wanted to get a sense of was, how are OBGYNs counseling patients? And what does it matter? I've had friends ask me, well, why do you even worry about diagnosing it during pregnancy? Because you can't do anything about it. You can't do surgery on the baby. You can't change anything. So what does it matter? But to the families, it matters a lot. And I think to the obstetricians, it matters because we have a little bit more to tell patients or help them plan for. And one of those things is, what kind of delivery should you have? If you look on the left-hand side, if the diagnosis was not known before pregnancy or before delivery, about 42% were counseled, yeah, you can have a vaginal delivery, and then the other 58% were counseled to have a C-section. In general, that seems pretty high. The general population rate of C-section is closer to about 30%. And I think that has to do with the fact that even though arthrogryposis might not have been diagnosed, many of those babies are breech. And so that ends up being a reason why they're recommended to have a C-section. But then on the right-hand side, if the diagnosis was known ahead of time, the number of people recommended to have a C-section goes up to 75%. The thought being that it's a less traumatic birth, and so we might be able to minimize injury to babies as they're born. So that was what they were recommended. Then if you look at the actual what type of delivery they had, the numbers are pretty similar. If they didn't know ahead of time, about 64% had a vaginal or a C-section. If they knew ahead of time, 80%. So overall, in all of the patients that respond, or all the moms and dads who responded, the overall delivery was about 30% vaginal deliveries and 70% C-sections. So the next thing we wanted to look at was, does it make a difference? Does doing a C-section really protect our babies against broken bones and birth injuries? So of the parents who responded, we had a total of 24 babies that checked the box that they had a broken bone. And of those, 20 of them happened during a C-section, and 4 of them happened during a vaginal delivery. Now remember, most of our deliveries were C-sections, so if you look at the percentages, 7% of all vaginal deliveries had a baby that had a broken bone, and 11% of C-sections had a baby with a broken bone. So maybe it's not as protective as we think, or maybe vaginal delivery is not as traumatic as we think. But I think we need more information. The original survey just had a checkbox for broken bone. It didn't say which bones or how severe was the injury, how severe were the contractures, which joints were involved, what was the baby's position. You know, I think if you have a child who has extension contractures in their arms, they probably fit through a vaginal delivery pretty well. That's how most babies come out. But if you have a child that's contracted and stuck with elbow flexion, then maybe that's a much higher risk. So we just don't know yet. Maybe a preemie will slide out no matter what position they're in, but a full term or an overdue baby has more risk. So we are in the process of developing a more extensive survey to ask some of those questions and tease out some of that information. Because again, I think it's important for OBs to be able to tell their patients, what should we do? So looking at some other recommendations for how bad currently OBs are at counseling their patients. This one was a question about, where did your doctor tell you you should deliver? On the left-hand side was what was recommended, and the blue piece is a normal hospital with a regular nursery, and the green piece is a NICU, a neonatal ICU. Then on the right-hand side is, where did your baby actually go after delivery? And almost 3/4 of them ended up in the NICU. So for a family that doesn't live in a town that has a NICU, it might be important to be able to counsel them ahead of time that, hey, you need to think about driving 2 hours to the nearest NICU to deliver your baby. And not all of those babies were critically ill. Some of them just went to NICU because the doctors didn't know what to do with them. And so they said, well, let's just go observe you in the NICU and see how you do. So it's maybe not as intense as what this number shows, but I think it still speaks to the fact that we need to have more information to counsel our patients. This is another counseling issue that kind of breaks my heart. I asked whether or not your doctor talked about termination of pregnancy. And I'll start on the right-hand side. If you weren't diagnosed until after birth, then obviously there weren't really many reasons to talk about termination of pregnancy. So 72% said they didn't even talk about it. But on the left-hand side, if you received a diagnosis of arthrogryposis prior to delivery, it was talked about, it was discussed, and 50% of those parents said it was recommended to me to terminate my pregnancy. That's 50% of parents who went on to have a child, who took this survey because they were parents. And I think that's a huge red flag to the medical community, that we need to have better information before we start telling these parents something as life-altering as termination of pregnancy. So if I asked the survey respondents, how much do you think your doctors know about AMC, or how much did you think they knew? And sadly, OB is at the bottom of the list. Only on a scale of 1 to 100, we scored about a 25, which is pretty bad. Pediatricians were not much better. And then as you get into the types of professions that already deal with kids with arthrogryposis, PT, OT, speech therapy, and then specialists like orthopedics, of course, parents felt like they knew more because they deal with them more. But OB really needs to bring that number up quite a bit. So these are just a couple of the quotes from that section. Parents said, we need OB doctors with more knowledge. The most frustrating part was the lack of consensus among providers. They'd go see this doctor, they'd tell them one thing, then they'd go see the specialist, and they'd tell them something else. We need more correct knowledge on the part of the medical community. And this one, I think, is also kind of breaks your heart a little bit. Our doctors gave us little to no hope or positivity about our pregnancy. It was the worst 20 weeks of my life. My son is so much better than all the horrors I dreamt up that were perpetuated by the negative news from our providers. And I think that's probably a pretty accurate statement. I think we in the medical community tend to present the worst case scenario or the doom and gloom in an effort to help our patients prepare themselves, but it's probably not always what the parents need to hear in that moment. I felt like my doctor didn't fully listen to me. Doctors need to be humble enough to reach out and admit when they don't know. And I would like to see doctors more involved in support groups to gain a better understanding of what parents go through. So the other thing that I think we need to, as OBs and radiologists, we need to be more aware of is the perception of fetal movement. We need to do a better job of looking for it on ultrasound, but we also need to do a better job of listening to our moms. Maternal instinct is huge in pregnancy, and I think the scientific aspect of it kind of, as clinicians, we're looking for the scientific data and the things that we can put our hands on, but we really need to step back and listen to moms, because there were many women who responded. I questioned why he was always in the same position, and I was told, oh, he just likes it that way. Or, I told my doctor I hardly felt any movement at all, and all she did was listen to the heartbeat, and I wish she would have been more concerned. Or, we could see that our baby was moving on the ultrasound, but we never realized that it was just moving his body. And it wasn't until my MFM ultrasound, this is actually my quote, that we realized that his arms and legs were always in the same position. So we have a couple of next steps that we're looking forward to. The first one is to expand this survey. We now have, at my home hospital, we have an institutional review board that has approved the survey. We have patient consent, and so we're able to collect data that then can be reported and hopefully eventually distributed in a better manner. This is an organization that my husband Ian and I have started. We called it Take Time for AMC. I'll get into that a little bit more in a minute. But as far as the survey goes, it's just getting more detailed about what were the findings on ultrasound. Did they evaluate fetal movement? What was the position of the baby at delivery? Did they sustain any injuries? What advice did you get from your OB? And then hoping to collect some of that information for a more centralized database. So the Take Time for AMC awareness campaign was kind of born out of preparing for this conference. The time part of it stands for thorough intrauterine movement evaluation. So we're hoping to be able to encourage the medical community to have a more intentional evaluation about fetal movement. Take 2 more minutes during your ultrasound and just watch each limb, make sure it's moving. It won't take that much time, but it could make a huge difference. And then hopefully as we gather more data, we'd like to take our information and our awareness campaign out to other meetings and societies like ultrasound conferences and obstetrician conferences, radiology, just to get more awareness out there. And then ultimately we'd like to then be able to advocate for changing what the consensus guidelines are. That first checklist that I talked about that just says, look and see if they're there. We want to change the checklist so that it's a more thorough evaluation. We want it to be easily accessible for providers. When I first found out that I was having a child with arthrogryposis, I Googled it and I found nothing in my medical literature that was helpful to me as an obstetrician. So I want there to be something out there that OBs can go to when they first have a patient diagnosed and say, okay, we have this patient now, here's what we need to do. Again, encouraging adding fetal movement to the standard anatomy scan. Coming up with consensus guidelines as an OB community as far as what should we recommend to our patients. Can they have a vaginal delivery? Should they have a C-section? When? Is it 37 weeks? Is it 39 weeks? Does it make a difference? And then gathering more information about the range of conditions and the outcomes, giving doctors better stories to tell patients so that we have more hope to share with them, not just the doom and gloom. We've seen lots of videos from the other presentations of here was the child when they first presented to me, and here is them after their surgeries, they're up and walking. And I think it's something that we could provide in the OB setting too, to give patients a little bit more hope and something to look forward to. Sensitivity training for our medical providers. That a lot of patients have said, they said the stupidest things to me, and even my husband and I would joke when we would look at our son, his arms were always up by his face. We called him our little T-Rex because we didn't realize that he couldn't move them. We just thought he was, so we nicknamed him T-Rex. And in our own little family, that's okay. But if I, as a provider, said something like that to a patient, that could be a little insensitive. So some sensitivity training for our providers would be good too. And then providing resources for patients as well. So thank you for coming to listen. This is my messy-faced little guy. He's here in person as well, if you want to come say hi. And then the taketimeforAMC.org website, you're all welcome to visit that. That is where the link to the updated survey can be found. So if there are any AMC parents in the room who would like to help us out by taking that, or anybody that wants to take it back home and share it with patients, feel free. And any questions? Sure, come on over. He's very friendly. Yes. Absolutely. Well, right now, that's an excellent question. I have some flyers in the back you can pass out, but I would like to start the same way that I started the first survey by disseminating across social media, because it's a great way to get it started, to get it out there. But then also sharing the link with providers in the medical community as well, that they can then share with their patients. And so any suggestions you have on how to get it out there, I'm happy to take into consideration. Any way that we can spread it is, the more data we get, the better. Yep. Right. Yep. Thank you. Yeah, it's in its infancy, pun intended, but we're hoping that over the next several years we can really get a lot of data and make some impact. In my own practice, we have changed our scheduling of how we schedule our routine anatomy scans. It used to be 30 minutes, we changed it to 40, just to give our sonographers more time for that initial evaluation. MFMs, absolutely, yep. Yeah, we have a group at our institution that's sort of collaborating with us on this project, and so they're hoping to disseminate it through their groups as well. Thank you. Yeah. I certainly think it should be shared. I don't know that there's been any specific studies looking at it, but I know that Dr. Hall is a big proponent of drinking caffeine and getting up and exercising and moving and getting as much movement as possible for the intrauterine environment. So I think that's definitely something that we can look at and can advocate for as we're talking about all this stuff. It would be very interesting to figure that out. Yeah, I think that that's something that it didn't really pan out in the survey. maybe I didn't ask the question the right way, but the majority of patients in the study delivered between 38 and 40 weeks, whether that was just by natural labor or intentionally. I didn't ask that specifically, but I think that probably we will find that somewhere between that 37 to 39 week range is going to be optimal for full lung maturity, but minimizing the restriction of the intrauterine environment. There are other conditions that are recommended to be delivered early, things like placenta previa or twins, things like that are recommended to deliver between 36, 37 weeks, and those babies do very well from a respiratory standpoint. So if that is something that we can advocate for our babies, if it makes a difference, then I think that's another exciting piece that we hope to tease out. All right. Well, thanks everybody for coming. Feel free to share some flyers. Feel free to come get some hugs. Have a great day.